As we age, certain health issues become more common, and understanding these can help us take better care of ourselves. For people over 55, there's a few key illnesses that often come into play. From heart disease to diabetes to arthritis and dementia, these conditions can significantly impact daily life. But knowing about them is the first step toward prevention and effective management. In this video, we're looking into the top health concerns, offering insights into why they're more prevalent as we get older, and some important practical tips on how to stay healthy and active, even well into your golden years. Let's start off with a big one: heart disease. Heart disease is a term that covers a variety of conditions affecting the heart, including coronary artery disease, heart failure, and abnormal heart rhythms known as arrhythmias. These conditions can seriously impact your health, often leading to heart attacks or other severe complications. As we get older, particularly past the age of 55, the risk of developing heart disease increases. This is due in part to the natural aging process. Our blood vessels lose some of their flexibility, which makes it easier for plaque to build up in the arteries. Now, imagine a brand new garden hose, flexible and supple. This is your vessels when you're younger. Now imagine a garden hose you've been using for 3 to 4 years and has gone through its fair share of being rolled over by your car tires, sitting out in the sun. That's kind of how your blood vessels are when you turn 55. They become less flexible and less forgiving. Now this plaque buildup, combined with other factors like high blood pressure, high cholesterol, and lifestyle choices such as diet and physical activity, all contributes to increased risk. Preventing heart disease involves taking proactive steps to maintain heart health. Nothing good in life comes easy. Eating a balanced diet full of fruits, vegetables, whole grains, it's essential. Regular physical activity, also important. Not only does it help maintain a healthy weight, but it also keeps your heart strong and functioning well. Now, managing stress, another key aspect, as chronic stress can really affect your heart. And this one is a given, but smoking, significant risk factor for heart disease, so avoiding tobacco products is definitely your first step at improving your heart health. And lastly, don't forget about your regular checkups with your healthcare provider. They can help you monitor important risk factors like blood pressure and cholesterol levels, allowing you to manage them before they lead to more serious issues. Cancer. Did you know that over 3,000 Canadians and a staggering 40,000 Americans are diagnosed with cancer each week? It's heartbreaking, and not just for those facing the illness, but also for the loved ones. Cancer is a condition where cells in the body begin to grow uncontrollably, forming tumors and potentially spreading to other parts of the body. And there's many different types of cancer, but some of the most common among older adults include breast, prostate, lung, and colorectal cancers. The likelihood of developing cancer increases as we age, particularly after the age of 55. This heightened risk is partly due to the accumulation of genetic mutations over time, as well as the natural decline in immune function that really makes it harder for the body to fend off abnormal cell growth. And if that wasn't enough, lifestyle factors such as smoking, poor diet, and excessive sun exposure play a significant role in the development of certain types of cancer. Preventing cancer involves a combination of regular screenings and healthy lifestyle choices. Screenings like mammograms and colonoscopies can help detect cancer early when it's most treatable. Eating a nutritious diet, avoiding tobacco, limiting alcohol consumption, also very crucial steps. When you go out under the sun for a prolonged time, make sure you're protecting your skin by using sunscreen and wear protective clothing. Bottom line is, cancer really sucks. If you want to avoid it when you're older, you better start making some positive changes to your life. Chronic obstructive pulmonary disease. So chronic obstructive pulmonary disease, we know better as COPD, is a term used to describe a group of lung diseases, including chronic bronchitis and emphysema, that cause airflow blockages and make it hard to breathe. People with COPD often experience symptoms like shortness of breath, persistent cough, and a feeling of tightness in the chest. This condition tends to become more common as we age because of long-term exposure to harmful substances that irritate our lungs. These irritants include cigarette smoke, air pollution, and certain dust and chemicals that people might encounter in various work environments. Over time, these substances all collect and can cause damage to our lungs, leading to the development of COPD. So preventing COPD, it largely revolves around protecting your lungs. The most crucial step you can take is to avoid smoking, or just quit if you already smoke, as tobacco smoke is the leading cause of COPD. That's a given, am I right? It's also important to steer clear of environments where you might be exposed to harmful lung irritants. Regular exercise can help keep your lungs strong, and maintaining a healthy diet supports overall lung health and helps your body function at its best. Diabetes. Diabetes, especially type 2, is a condition where your body either becomes resistant to insulin or doesn't produce enough of it, leading to elevated blood sugar levels. Now, insulin is a hormone that helps your body use sugar for energy, and when it doesn't work properly, sugar builds up in your bloodstream instead of being used by your cells. This can lead to a range of health issues if not managed. The risk of developing type 2 diabetes increases with age. This is partly due to a natural decline in how well your body responds to insulin as you get older, known as insulin resistance. Also, as people age, they often become less physically active, which can lead to weight gain, and that is a significant risk factor for type 2 diabetes. Now, preventing diabetes involves adopting a healthy lifestyle to manage your weight and keep your blood sugar levels in check. Eating a balanced diet that's low in refined sugars and high in fiber can help regulate your blood sugar. Also, staying physically active, very important, because regular exercise helps your body use insulin more effectively. It's also a good idea to have your blood sugar levels checked regularly, especially as you get older, just to catch any early signs of diabetes. Arthritis. Now, arthritis is a condition characterized by inflammation of the joints, which leads to pain, stiffness, and reduced mobility. The most common form is osteoarthritis, which occurs as a result of wear and tear on the joints over time. This wear and tear gradually breaks down the cartilage that normally cushions the ends of bones where they meet to form our joints. But without this cushioning, bones can rub against each other, causing a ton of pain and discomfort. Another form of arthritis is rheumatoid arthritis, which is influenced by age-related changes in our immune system, leading to inflammation that can also damage the joints. When we age, the risk of developing arthritis increases due to natural breakdown of cartilage and the body's changing immune response. To prevent or manage arthritis, it's important to stay active to maintain joint flexibility. Regular physical activity helps keep the joints moving smoothly and can prevent stiffness. It's also crucial to maintain a healthy weight, as excess weight puts additional stress on your joints, particularly those in your lower body, like the knees and the hips. Low-impact exercises such as swimming or cycling are particularly beneficial because they allow you to stay active without putting too much strain on your joints. Lastly, strengthening the muscles around your joints can provide better support and reduce the risk of injury. Hypertension. You might know hypertension as high blood pressure. It's a condition where the force of blood pushing against the walls of your arteries is consistently too high. This increased pressure can cause damage to your blood vessels over time, leading to serious health issues like heart disease, stroke, kidney problems. When we get older, our blood vessels tend to stiffen naturally, as we've discussed previously, and this stiffening of blood vessels can make it easier for blood pressure to stay high. Lifestyle factors such as a diet high in sodium, a lack of physical activity, and chronic stress, they all contribute to the development of hypertension. If high blood pressure is not managed, it can silently cause damage to your body, leading to significant health complications down the line. In order to prevent hypertension, you need to make some key lifestyle changes. Reducing your sodium intake is absolutely crucial, as too much salt can cause your body to retain water, which raises your blood pressure. Eating a balanced diet rich in potassium, which helps balance out the effects of sodium, that can also help. Staying physically active is important because regular exercise strengthens your heart, allowing it to pump blood with less effort, which in turn lowers the pressure on your arteries. Now, managing stress, limiting your alcohol consumption, and regularly monitoring your blood pressure are also essential steps in keeping hypertension at bay. Alzheimer's disease. Alzheimer's disease is a pretty bad one. It's a progressive neurological disorder that gradually erodes memory, cognitive abilities, and the ability to carry out even the simplest tasks. It's the most common cause of dementia, a broader term that describes severe cognitive decline that interferes with daily life. People with dementia may experience confusion, disorientation, and difficulty with reasoning and judgment. Alzheimer's and other forms of dementia are particularly common after the age of 55, largely because age is the most significant risk factor. When we get older, our brains undergo natural changes that can increase the risk of these conditions. Genetic factors, they also play a role, making some people more susceptible. Now, although there is no sure way to prevent Alzheimer's, there are steps you can take to lower your risk and promote your brain health. Regular mental stimulation, such as doing puzzles, learning new skills, or engaging in activities that challenge your mind can help keep your brain sharp. Staying socially active is also important, as social interactions can provide mental and emotional support. Regular physical exercise benefits the brain by improving blood flow and reducing the risk of conditions like hypertension, diabetes, and both of those are linked to cognitive decline. A brain-healthy diet rich in fruits, vegetables, and omega-3 fatty acids found in fish, They can also support cognitive function. And lastly, managing cardiovascular risk factors like high blood pressure and diabetes is crucial, as these conditions can impact brain health. Depression and anxiety. This is really the silent killer because not a lot of people are willing to talk about it until it's too late. Depression and anxiety are mental health disorders that can significantly impact your emotional health and your quality of life. Depression often manifests as persistent feelings of sadness, hopelessness, a lack of interest or pleasure in activities you once enjoyed. Anxiety, on the other hand, is characterized by excessive worry, fear, nervousness, and it can just be overwhelming. These conditions can become more common as we age, particularly after 55, due to various life changes. Events such as retirement, the loss of loved ones, dealing with chronic illnesses, and decreased social interaction, they can all contribute to the feelings of depression and anxiety. Additionally, changes in brain chemistry and the physical toll of aging can also play a significant role in the development of these disorders. Now, preventing depression and anxiety involves taking proactive steps to maintain your mental and emotional health. Staying socially connected is vital, as strong relationships and regular interactions with others can provide emotional support and reduce feelings of loneliness. Engaging in regular physical activity is also important, as exercise can boost mood and reduce symptoms of anxiety. Maintaining a healthy diet supports your physical and your mental health. Managing your stress effectively through techniques like meditation, mindfulness, or counseling can help prevent the buildup of anxiety and depressive symptoms. If you're experiencing persistent feelings of sadness or worry, it's important do not hesitate in seeking help from a healthcare provider. Early intervention can make a significant difference, and treatment options are available that can improve your quality of life. Now, knowing about common health issues for those over 55 can help us stay on top of our well-being. By understanding these risks and taking simple steps like eating well, staying active, seeing your doctor regularly, you can manage or even prevent many of these conditions. Aging can be challenging, but it's also a chance to make positive changes. It's never too late to take charge of your health and make choices that keep you feeling good and living well. Thanks for watching. Remember, with a dash of effort and a pinch of self-care, you'll be rocking that youthful glow for years to come. If you've enjoyed this video, subscribe to our channel where we uncover more Revitalixer recipes.